This video training series is courtesy of the County of San Diego Office of Emergency Services.
Every emergency call, every emergency run, every life saved starts with you, the first responder.
But what do you do when confronted with evacuees with needs who may pose a challenge to your typical training methods?
The following video is one of a series of 8. It's designed to educate you on the various visual cues, do's and don'ts, proper behaviors, mannerisms, and sensitivities relating to those members of our San Diego community with chronic illness.
Our hope is that you learn as much as you can so that when lives are depending on quick thinking and fast maneuvering, you have the knowledge and training to make the best decision possible.
Hello, Dr. Haynes. I'm Greg George. I'm a fire captain and paramedic with San Diego Fire Rescue. And I appreciate the opportunity to talk to you about individuals with chronic illnesses.
Thank you for having me. I'm Bruce Haynes. I'm a physician trained in emergency medicine, and I'm the medical director for the Emergency Medical Services System in the County of San Diego.
What are some of the chronic illnesses that are susceptible to stressors, and why is that?
Some of them would be diabetes or heart disease. Diabetes, there's a rush of adrenaline in your blood, and that can drive up the sugar very high so that it needs treatment right away. People can have anxiety attacks and difficulties.
Are there any other examples of chronic illnesses that we should be aware of as first responders?
Yeah, I think you have to be careful right out of the box is cardiovascular disease, and that can be somebody with chronic disease, with chronic obstructive pulmonary disease or emphysema, or it could be somebody with asthma. And the treatments are a little different for both, but they can come up right away if there's a lot of smoke and particulate matter in the air. Usually in the wildfires that we have or in earthquakes, there's a number of people who will just have plain old heart attacks and die. So that's one thing to be looking for, is somebody who's having indigestion or chest pain or some other physical problem like that. Sometimes we'll see nervous problems such as anxiety, or people who have a seizure disorder may be prone to seizures because of all the excitement and everything that's going on. Another problem might be somebody who has diabetes. That can go out of control fairly rapidly from the rush of adrenaline that drives up the blood sugar level in the body. And so if that person looks like they're not making sense or they're a little confused, they should be tested to make sure their sugar level is not too high and not too low.
Can you come to the door, please?
How can we as first responders know that we're dealing with somebody with a chronic illness? Are there any specific visual cues?
Yeah, sometimes somebody will just look ill, and so that's probably a good way to do it.
Yes. Hi, I'm Officer Duncan with SDPD. We need to evacuate all the residents in the home. There's a gas leak down the street.
Other times you'll see that they're walking around not getting anything done, shaking, kind of concerned and scared.
I have some complications. I'm a diabetic, and I also have bronchitis.
Dr. Haynes, if we encounter a diabetic, are there any specific do's or don'ts?
The diabetics frequently would have their blood sugar pushed high as a result of the adrenaline in the person's body and the excitement and confusion and everything that goes with this kind of situation. So that's not going to be an immediate threat to them, but in some cases the person is going to have a low sugar because they use their insulin, they didn't take something to eat, and so you start seeing them being a little confused and not being quite right. And so that's the time that their blood sugar should be tested with their testing equipment to make sure they're going to be safe to get out of there on their own or with their family.
You need medication, devices?
Yep, and food as well.
Food, okay.
You just kind of shook me up right now. I think my blood sugar is kind of going crazy right now. I do have to get those things.
Okay.
Dr. Haynes, are there any specific sensitivities that first responders need to be mindful of when evacuating individuals with chronic illnesses?
People may have devices that they're a little embarrassed about, although typically they've had them for a while and it's not always a problem, but colostomy bags, urinary catheters, things like that they need time to kind of hook up and put together before they can be leaving where they are.
Dr. Haynes, what are some of the technical aspects that we as first responders should keep in mind when we're evacuating individuals with chronic illnesses?
I think one, you want to make sure that they do need help, they can't do it on their own, and look for that very carefully, because they may say, yeah, I can take care of this and I'll be okay, when in reality, some of these older people think they have the ability to help themselves in a bad situation like that, but they may not be able to fully get themselves out of there. And if they are going to go right then, make sure that if they have chronic diseases, that the equipment that's necessary goes with them. So for the diabetic, that would be testing equipment and some food to avoid low blood sugar or hypoglycemia.
Dr. Haynes, when we're dealing specifically with a respiratory patient, is there any equipment that we need to be on the lookout for?
The more minor patients might have metered dose inhalers, the little puffers that they use several times a day as rescue breathing, and that's very important in this situation where there may be bad air quality and they may be subject to having a worsening of their condition. For people with respiratory disease, where it's very common with the wildfires we get, to take their medications with them, and at least take a list of medications so that if they get into a shelter, we can figure out what they were taking and get them back on that medication. In some cases, people have more specific equipment, more detailed equipment, a nebulizer that has the spray that they can breathe in, and in some cases, people will have CPAP. They need to have that equipment with them probably to avoid problems if they've been on it.
Is there any additional advice that you'd give us as first responders encountering these individuals with chronic illnesses?
I think the focus on trying to help them as an individual and treat them calmly and with respect is going to be the best road. The other things that really are important that we found in the past in situations like this are their medical record, to the extent they have one at home, especially lists of medications, and if possible, the medications themselves, so that we don't have to go out and find their medications for them, but they'll have them.
Dr. Haynes, I really appreciate having had this opportunity to talk about individuals with chronic illnesses. It's very helpful.
Oh, thank you. It's an important issue, and I'm glad that we're all paying some attention to it and working on it.
This concludes the chronic illness video for first responders.
For more information, please contact the American Diabetes Association at 619-234-9897, the American Lung Association at 619-297-3901, or the Epilepsy Foundation of San Diego at 619-296-0161.
I'm Tony Meacham, San Diego County Fire Chief.
I'm Shelley Zimmerman, Chief of Police of the San Diego Police Department. Thank you for watching.